Hello friends, welcome to a new lecture. 44-year-old man who has had increasing dyspnea on exertion for 6 years has crescendo, decrescendo, systolic ejection murmur and S4. His carotids are pulsus parvus et tardus and chest radiographic shows pulmonary edema. His native aortic valve replacement is shown. Pulsus parvus et tardus is present in aortic stenosis. It also has decrescendo and crescendo murmurs. Why is this valve thickened with nodular densities? The valve is thickened with nodular densities because of dystrophic calcification, because of the abnormal valve. Although more common during the 8th and 9th decades, this man becomes symptomatic when he is 44 years old. Why? See, here there are only two cusps are seen. So this is bicuspid aortic valve. The people with bicuspid aortic valve congenitally have increased prone to this degenerative change at an early age. So as a result, this person has got this disease at 44 years of age. Where else can this mineral is deposited? It can be deposited in any inflammatory process like granulomas or atherosclerosis. Thank you for watching.